Return to work, chronic pain, and safe opioid usage in the workplace. I'd like to welcome Dr. Mykal Leslie, who is our expert and speaker today. And the objectives that we are going to look at today are to learn the impacts of chronic pain in the United States workforce and how the opioid epidemic has impacted individuals and employers. And also, we're going to outline some strategies for employers to mitigate opioid usage. And with that, I'm going to turn it over to Mykal.
Thanks, Kim. And I want to thank HGI and both you and Brandon for having me today and for inviting me here to speak. No, we just have a few minutes. Thank you all for joining us on your lunch break on this hopefully sunny Friday. I know that it's sunny and beautiful here, so hope that you're having a nice day as well. Want to talk a little bit about chronic pain, substance use, specifically opioid use in the workplace, and discuss some strategies on how employers and interventionists, VR professionals might decrease issues and increase recovery or an environment of recovery around that. So let's start off by talking about what is chronic pain. So in general, it's estimated that around 100 million people in the United States every year experience what we might say is pain. Pain is a very subjective term. It's very loosely defined. It's defined in a variety of ways. It's something it's really evolved from the 1980s on. We had what we call like the pain revolution, and it became what we might say is a fifth vital sign. It's hard to say that you went to the doctor if you're experiencing issues and they haven't asked you what's your pain on a scale of 1 to 10. So it's such a prevalent thing, and we started, especially in the last decade, to question whether that's really helpful. And there's a lot of pain experts, medical doctors, researchers in the United States that have started to say, maybe we're not doing the best thing by ourselves, by assessing pain the way that we do, by treating pain the way that we do. So definitely a big topic of conversation nationally in the medical field. Most pain is short-term from an injury, but around 40 million Americans, or around 20% of US adults, live with what we say is chronic pain. So this is ongoing pain that is not expected to go away anytime soon. Around 11 million of those, so around a quarter of those that living with chronic pain, experience what we call high impact chronic pain. What defines high impact chronic pain is that it's lasted 3 months or longer, and it's accompanied by at least one major activity restriction. So there's a life barrier, a life restriction, a functional limitation, if you will, that goes along with the chronic pain. That's really the defining characteristic. That could be an issue working outside of the home, going to school, working in the home, activities of daily living, those type of things. Excuse me. Here are some examples of very common chronic pain conditions: fibromyalgia, osteoporosis, people that experience chronic migraines. Arthritis is one of the largest, most prevalent chronic pain conditions in the United States. Back pain, chronic back pain, especially low back pain, is especially prevalent in kind of across the world in the United States. Reflex sympathetic dystrophy, nerve pain, especially leg nerve pain, arms, back. Cancer is one that has led to chronic pain for a lot of individuals, and sickle cell disease is one where individuals experience high degrees of pain in episodes chronically across their lifetime.
I appreciate this information, Mykal. And one of the things that I noted about those diagnoses is that most of them may not be visible in nature. And I felt like that was an important thing to mention for employers to be aware of, especially when they may be doing training for inclusivity in the workplace.
Yeah, that's such a good point. We think of physical disabilities sometimes as ones that are more visible in nature, and a lot of these pain conditions, you can't see them and you don't know that they're there and unless somebody tells you. And that's such a great point, Kim, and it really does impact how this is handled and how this is addressed in the workplace. So the physical and psychological consequences of chronic pain. So we know that the implications of chronic pain for a person are twofold, right? Obviously, there's the physical side of it. It hurts. There's tense muscles. There could be limited mobility, lots of energy and fatigue issues. Some individuals might also have a co-occurring chronic fatigue syndrome that they're experiencing, or CFS. Appetite changes, whether it goes up or down with the pain. It could fluctuate many times throughout the day. But what we don't talk about a lot is the psychological consequences of chronic pain. A lot of people experience depression, hopelessness. Is this ever going to go away? Anger. If only this hadn't happened, or why does this happen to me? Or, if only I could just have a few days where this wasn't here, I could accomplish X, Y, and Z. A lot of anxiety, right? Anxiety about what's going to happen. Am I going to have surgery? Am I going to have to, or am I going to have money issues? How am I going to pay rent, et cetera, et cetera. And then fear of re-injury is one we don't talk about much, but especially if the condition was caused by an accident, it could be, especially in the workplace, problematic, the person concerned about getting re-injured. And we say that's kind of a psychological symptom of the chronic pain. So risk factors, these are individuals who might be at a higher risk for developing high impact chronic pain and chronic pain. Women, people of African American, Native American, or Asian Indian descent, older adults, those who are previously but not currently employed, those with a high school diploma or less education, adults who are living in poverty, those who have been divorced, separated, widowed, or have never been married, and those living in rural areas in the United States. Those are just demographic characteristics. Those aren't causal factors, if you will, for chronic pain. Those are just individuals who tend to experience higher incidences of chronic pain for various reasons. So what brings us to the kind of crossroads, if you will, of chronic pain and opioids? Well, prescription painkillers are, or have traditionally, especially again, since the late 80s, early 90s, have been often prescribed to those with chronic pain issues. Previously, before that, we had a lot of chronic pain was treated with, physical therapy. And we said, you might never experience no pain, but you can get through it and you can develop some strength and you can reduce your pain. And then during this pain revolution that I mentioned earlier, it was thought, well, maybe we could actually get people to a point where they could live without pain. So we started to give people hope that we had these miracle drugs we could give them that could potentially lead them to a life without pain, period. And people were excited about that. They thought, if I could live a life without this pain, obviously I would be able to accomplish a lot more. My quality of life would be way higher. And so there was a lot of hope for these opioids. And at the time, they were reporting that they weren't that addictive and they didn't have that many negative consequences. And so it was kind of a win-win viewed by a lot of people that were dealing with pain, that, hey, these opioids are a great solution. Whereas before, opioids were really only prescribed for people with acute pain, an incidence of cancer. Now we're talking, they're getting prescribed for people that are living with pain and this condition that's not expected to necessarily go away anytime soon. People with chronic pain tend to be very susceptible to opioid use disorder. Opioid use disorder being the clinical diagnosis for somebody who has, quote unquote, become addicted to using opioids. What we know is around 1/4 of people with chronic pain end up misusing opioids if they're prescribed. So in other words, not using them via their prescription, but misusing them. Statistics will suggest that around 10%, so 8 to 12% of people who use opioids will become addicted to opioids and develop what we say is an opioid use disorder. So, the notion that everyone who uses opioids is going to become addicted to them is not necessarily true. In fact, it's the furthest thing from true. There's plenty of people who use opioids that aren't going to become addicted to those. However, 10% is still a really large number. that's a lot of people that will end up becoming addicted to opioids. And that's why we have such a crisis on our hands in the United States with this opioid epidemic that we've been having or experiencing year over year. Pain was previously believed to be a protective factor for preventing opioid use disorder. So if you had pain, well, you couldn't become addicted because it was actually the opioids were useful to you. They were treating your pain, which seems like a really strange thing to say, but the literature, it was there. People were saying that we think it's a protective factor, and as we've kind of hashed that out in study after study, it's not come to fruition. So we know that that's not true. Just because you experience pain doesn't mean you're immune to having an addiction to opioids. PTSD and other psychological diagnoses on top of chronic pain will significantly increase the odds of developing an opioid use disorder. So if you have depression, anxiety, PTSD, any other psychological, diagnosis, chances are higher that you might develop an opioid use disorder. So that begs the question, are opioids a good use to treat chronic pain? This is, again, a very well contested topic of late. I think that there's a lot of sides to this story, but a lot of medical research is suggesting that they are not the best option, that they should not be the first choice for chronic pain. Now, there are some potential exceptions, like individuals with really acute issues of pain who are experiencing sickle cell disease. But evidence does show that there are less risky medications that can be equally as effective in treating opioid medication that don't have all the secondary consequences that using opioids has. If opioids are decreased slowly, pain and function can actually improve. So what we see is that people who are taking opioids, their body gets used to no pain at all. And so if they just experience a little bit of discomfort, they actually experience it more significantly than if they weren't taking opioids. So in a weird way, opioids actually causes pain to get worse in some instances. So people on opioids might actually be experiencing more pain than people not on opioids, which seems very counterintuitive for the way that we treat things. Now, I want to put a disclaimer out there and be very careful to say that there are large groups of people, advocates of individuals with cancer or those with sickle cell disease, that want to make sure that just because we're moving away from treating chronic pain with opioids doesn't mean that we just completely restrict access to opioids for people with those very acute, significant pain episodes like those in cancer or sickle cell disease, as I mentioned, because sometimes as a result of us trying to restrict opioid use in the entire population, people that might really, really need it for these really extreme pain episodes are not getting it. And so again, like I said, two sides to every story. We need to kind of temper what we're saying, understanding that this conversation is very complicated and very nuanced. Opioids should never be the only chronic pain treatment. So starting an opioid medication should be done as a limited trial with a set end date before reassessment of the risks and benefits of continuing treatment. So we need to make sure we're talking about the end from the beginning, that we're very careful if it's going to be used, it's used as a last resort, etc. I mentioned the opioid epidemic or the opioid crisis in the United States. As I said, we're in the midst of this with the misuse and addiction to opioids becoming a very serious national crisis. It's evolved. We say that there's 3 different stages. Mostly we name the stages by the prevalent issues of overdose deaths. That sounds very morbid, but that's how we identify the stages. At first, it was prescription painkillers, and then heroin overdose deaths became very prevalent. And so that was kind of phase 2. And then in phase 3, which happened in the early 2010s, we moved to illicitly manufactured fentanyl as being something that skyrocketed as far as overdose deaths. So we went from the actual pills, medications that people were using, like Oxycontin, for example. Then we shifted into heroin that was being used by individuals. It was very accessible in illicit networks. It was very cheap for a period of time. As the government and medical community closed in on prescriptions, and then it's shifted over to the things like fentanyl and carfentanil, which we've seen rise pretty substantially in the last decade. Drug overdose deaths are now the leading cause of accidental death in the United States. Opioids are the most common cause. Oftentimes, it's opioids in conjunction with another substance, whether that be a stimulant or alcohol. But opioids are typically present in, I think, 2/3 or more of the overdose deaths in the United States. Since 1999, opioids have been responsible for over 700,000 deaths in the United States. And the estimated economic costs have exceeded $500 billion. So there's a human cost and an economic cost to this crisis that is substantial. So no matter how you want to look at it, whether it's, hey, is this a humanitarian effort? Yes. Is this an economic effort? Yes. There are big consequences on both sides of the coin. It's estimated that around 1.7 million people in the United States have substance use disorders that are related to prescription opioid pain relievers. So that's a huge number, and around 652,000 from a heroin use disorder specifically. There's around 4 to 6% of people who misuse prescription opioids that transition to heroin, and around 80% of people who use heroin first started on using prescription opioids. So just some quick numbers. In 2019, we had, unfortunately, 70,000 overdose deaths in the United States. 70% of those were related to opioid use. So that's around 137 people that, again, unfortunately pass away every day. With the COVID-19 pandemic that we've been experiencing, unfortunately, we've seen a rise in numbers of drug use. So this has been an increasing issue. Opioids in the workplace, more people are using opioids in the workplace than out of it. The fact is that a majority of people in the United States are employed. So therefore, most of the people with substance use issues in the United States are happening in the workplace, or they're using in and around the workplace. That's just the sheer number of individuals that are employed. Prescription drug use is a common issue in various industries. They are very common in the services sector. Different occupations such as transportation, maintenance, construction, all of those have really high rates of prescription painkiller use. Opioid use is especially high for the industries, like I said, with high rates of on-the-job injuries, mining being another one that I didn't mention. Rural employers are typically more susceptible to opioid issues due to the high availability of prescription opioids in those areas and the high on-the-job injury rates. So workers' compensation costs are typically increased due to prescription opioid use and abuse, as are high healthcare costs. So employers, this is important for employers because it's costing them a lot of money. It's also important because it's a significant safety hazard to work environments, and it's associated with high levels of both absenteeism and presenteeism. Prescription drug use alone, misuse accounts for $25 to $53 billion in lost productivity every year, which I know some of you are intimately familiar with. While out of work, opioids can increase workers' comp associated costs. They can delay employee recovery from injury, and it can overall just take a longer time for someone to be out on disability leave. Up to over a quarter of lost time claims were associated with having at least one opioid prescription, and workers' comp cases that involved just one opioid prescription ended up costing more than 3 times the claims that did not involve opioids. So again, significant issue for employers, people that are using opioids.
Yeah, and even outside of workers' comp, I feel like your first sentence summed it up, Mykal. The slide really shows how much opioids impact employers' productivity, safety, and retention of those valued employees that affect their overall cost of conducting business.
Absolutely. So what do we know about substance use in the workplace? Again, most people with substance use issues are in the workplace. No employer is immune to this, either the human or the monetary impact of this. Being out of work increases the chances of relapse substance use. So for people that have to leave work because of the issues, chances are it's going to make their psychological, physical, and substance use issues worse. So it kind of is a negative cycle that we get into. It snowballs. Lack of access to healthcare and health resources. It can also exacerbate the effects of their chronic pain conditions, financial instability, from being unemployed or getting fired. It can be a stressor that can trigger substance use. So by implementing effective practices, we know that employers can actually help improve quality of life for their employees and their families, as well as prevent substantial costs associated with the substance use. So I've identified the problem. It's a significant problem. It's affecting people. It's affecting families. It's affecting employers. And what's the good news is, however, employers can be part of the solution, so they can make a positive humanitarian impact on people and families, and they can save themselves a lot of money by doing certain things. And so that's what we're going to talk about. How do we decrease the impact of substances in the workplace? Employers who invest in providing access to substance use treatment for employees can see as high as of a 13-to-1 ROI. So the return on investment can be pretty substantial for employers. Employees who receive treatment and enter recovery from substance use showed a 36% decrease in absenteeism and a 13% decrease in work turnover. Employer-sponsored and monitored treatment tends to produce better recovery results than treatment sought at the request of friends or family. They were more likely to actually follow through and do what they needed to do if there was an employer that was getting them treatment, rather than if their friends or family were pressuring them to do it. Employers that have things like EAP or mental health programs are especially successful in this. They provide screening and referral services. So they do some postvention, but they also, do some prevention by doing screening, confidential referral services. There's a big cost savings over time. Confidential aftercare follow-ups are really important too. So something happened, you've provided treatment, and now you're trying to be preventative of their relapse in the future, because a lot of people with substance use issues end up relapsing. So if you're providing effective confidential aftercare follow-ups, that can be a really successful long-term tool in helping employees with substance use issues. Drug testing can also be a critical resource. It has to be done the right way. There's a lot of nuance to doing drug testing, but when done the right way, and there's a lot of best practices out there, we'll give you a link to some resources. It can be a really effective way to maintaining safe work atmosphere. Just having the program or utilizing the EAP, however, is not enough. You need to impact the atmosphere of the workplace, which is really important. And that's not just the top down. It has to be the coworkers, the supervisors, the managers, the executives at the company. Everybody's got to be sending the same message, the culture that decreases stigma and raises awareness. This is not a weakness. We don't need to be singling people out and punishing people. We don't need to be punitive. We need to be understanding this is a disease that is present in every workplace. And we need to treat it just like any other issue, where if somebody needs to be off work, they need to get treatment, and we're going to get them back as soon as we can, as soon as they're healthy and well. If an employee is fearing retaliation or disciplinary action, they're not going to tell you if there's an issue, and they're going to try to hide it, and they're going to conceal, and that's going to cause a world of issues, again, monetarily, and that's going to cause some workplace environment issues between coworkers, for supervisors, et cetera. So having a confidential process is critically important for employees to seek help, go through the appropriate channels, report warning signs, anything they observe. It's recommended that as part of the process of educating both your supervisors, your coworkers, et cetera, that employees be trained on warning signs and indicators that someone might be experiencing substance-related issues.
I really love the fact that you highlighted employers having these conversations, doing the training, having those available resources like the employee assistance programs that focus on employee options for recovery and return to work, because that's going to assist in not only at the identification of an issue, which I know you're going to talk about on this slide, but also the resolution, so employees don't just see it as a punitive approach. So thank you for doing that.
Yeah, that's really well said, Kim. Thank you for that. These are some red flags. I know in the spirit of time, I know Kim's got some stuff she wants to share with you too, but I just want you to see, these are some red flags that, if you're trying to say, what do we train people to look for? These are what you're looking for. Employee behaviors, not very overt things, sometimes a little bit more covert things that you can be looking for to start thinking, okay, if there's a problem, how do we approach it appropriately? How do we identify and talk to somebody about whether there's an issue? Do they have a trusted person in the workforce, a coworker or supervisor that has a relationship with them that can broach this subject? That's a hard thing to do. And then we get to disclosure. So employees, even though you identify something, they still might be reluctant to say, hey, I have a problem, or I need help. So, or they might be afraid of getting fired. So how do we deal with that? Well, again, it's about creating a culture of confidential and fair treatment of employees. If there's a record of them hearing other people are getting treated poorly and unfairly, or they went to talk to their supervisor or the EAP about an issue they're having and it got leaked and it's rumors and everybody knows, they're not going to tell anybody. So it's got to be a culture of confidential, fair treatment, awareness, acceptance of substance use disorders as a disease rather than some kind of moral failing. Those are the environments that we see most likely to succeed in having successful treatment for people. Is it going to work 100% of the time? No, it's not always going to work 100% of the time, but it's going to save a lot of money and it's going to help a lot of people. When an employee discloses a diagnosis, they should be presented with options for treatment, accommodations, clear and reasonable expectations for behavior and consequences for any continued performance issues or substance use. Again, it shouldn't come off as punitive, but you can identify it and you say, hey, if this continues, this is what's going to happen. It doesn't have to be extremely punitive. And lastly, for accommodations, if you're wondering what kind of accommodations can I offer someone with a substance use disorder, we've provided some links here. You can go in and check out. The Job Accommodation Network has some excellent resources for how to accommodate and deal with substance use issues in the workplace. So I'm going to turn it back over to you, Kim. Thanks so much.
Thank you. That was great information and a lot of information in a condensed period of time. So thank you for that. There are incentives to employers to hire individuals with disabilities and individuals with chronic pain and substance use disorders. So there's the work opportunity tax credit, disabled access credit, barrier removal tax deduction, and also there are incentives for hiring veterans. And Retain Kentucky can help individuals with chronic pain and substance abuse disorders may be eligible participants to focus on their stay at work and return to work goals. And I'll talk here in a minute about who's eligible for Retain services. So if those individuals have a medical condition or illness, as we've been discussing, chronic pain or substance use disorder that's not work related, currently in phase 1 of Retain, they need to live, work, or receive health care in one of these 14 counties that surround Lexington and Louisville. They need to be currently employed or have been employed in the past 12 months and have not applied for or received federal disability benefits, including Social Security disability insurance and supplemental security income. So some of the inclusive workforce strategies and services that we can provide at Retain and speak to what Mykal shared about how an employer can address chronic pain and opioid use in the workplace can include functional job descriptions, universal design, job accommodation support, assistive technology, work supports, peer mentoring, job seeking skills training, job search support. We can also help with collaboration with the healthcare provider through our return to work coordinator case management services. Now, you might say, hey, as an employer, I don't need help with all of this. I already have all of this or much of this in other programs that are successful, and that's fine. As the Retain program, we want to help you where you need help, and we can fit into those areas where you still might need some assistance without encroaching upon other areas where you're doing just fine. Other needs that your employees might have is social barriers or social determinants, and we can help you retain those valued employees. If they're having some return to work barriers with, shelter, rent, mortgage, if they have food insecurities, trouble getting to and from work, or clothing or uniforms for work, child or elder care, or any additional health care needs, we have the networks to connect them with to get assistance to help overcome those barriers. And it's really simple to refer to Retain. You can call 859-562-3251, email us at retain@uky.edu, or visit our website at kyretain.org. I would like to say that the information that Dr. Leslie provided today is just an appetizer. Hopefully it whet your appetite to learn more. And he was kind enough to provide us with, I believe it's about a 2-hour training on substance use disorders from an employer perspective. And it's available at no cost. And it can be found at www.hdillearning.org. So check that out. And there's also great resources at the National Safety Council. They have an Opioids at Work employer toolkit that includes policies, fact sheets, presentations, safety talks, all kinds of information so that an employer can implement a workplace program on opioids. So nsc.org is where you can find that. And this presentation today, as well as all of our employment seminar series, can be found on our Retain Kentucky media site at this address. But if you just go to YouTube and look for Retain Kentucky Media, you will find it there. And again, this will be uploaded and recorded as well on that channel. So with that, I would like to thank everyone today for their time. I don't see any questions. So thank you all. Please feel free to reach out if you have any questions after today, and we would be happy to answer those for you. And thank you so much, Dr. Leslie, for this great information and your expertise. We very much appreciate it.
Thank you very much, HDI, for having me. Thank you all for taking your lunch time to be with us today. As Kim said, if you have any questions, please reach out. I'd love to interface and have some more discourse with anybody, or just hear about what's going on for you and kind of your kind of niche in this field and with some of these issues. So anyway, thank you so much for being here. Thank you, Kim, for having me.
Thank you. Bye-bye.